you recently been to your doctors because you're not feeling too great and you've had some blood taken only to be told that actually you're in the reference range, everything's fine, but yet you still feel terrible? What's going on there? Well, the reference range that GPs use is so broad. You could be right at the bottom of the reference range, verging on going into underneath what's acceptable and feel terrible, but actually you're within that reference range. So you're going to be told everything's normal. Reference ranges are a funny thing. They're based on results from collation over the years, but if you think about it, if you go to the doctors to have your blood taken, you've gone there generally for a reason. You're probably not feeling too great. These reference ranges are based generally on unhealthy circumstances or unhealthy people that are feeling a little bit off kilter. In my profession and in naturopathy and functional medicine, the reference ranges are different. The reference ranges that we use are based on optimal health. They're not based on results taken from people that are ill. So our reference ranges are a little different. And what we're looking for is that subclinical level where you're not quite right. And that's why you're feeling so ill and rubbish. For example, I'm just about to post this one off. This is a B12 test, but the way we test B12 is very different to if you go to your GP. You see, some people really struggle with how they use B12 once it's been taken into their bodies. So it might be circulating round okay and would show up okay on a GP's test. But there's something called active B12, which is very different and isn't generally tested by the National Health Service. But it makes a big difference. So if you have a good serum level of B12, but a low active B12, you could be getting all the symptoms of B12 depletion. Tiredness, fatigue, heart racing, tingling, cognitive difficulty, so brain fog, that sort of thing. You could be getting all these symptoms and yet show up as fine at the GP. So very soon I'm going to be offering a service where I can have a look at your blood test results for you and just cast my eye over them in terms of our optimal ranges. And if you wanted to explore your health in greater detail and you're frustrated being told that everything is okay at your GPs, then come and see me and we can talk about using our optimal ranges. Because really, all of us deserve to be right in the middle of optimal, where we are functioning with vibrancy and energy and health and vitality.